Health Sciences North is pleased to present its new strategic plan for 2013 to 2018. Our plan will be a catalyst for change. That change begins within our own walls, and we believe it could have global reach. We are redefining what it means to be a hospital. We are redesigning healthcare within our walls and beyond. In essence, we are creating a hospital without walls, one that takes away the many barriers to care. We are transforming the way we think, see, and act about healthcare. At the core of this change is a patient-centered approach to care. This approach will improve how patients and families experience the healthcare system. But it is not enough to merely accommodate change. We want to lead it. To accomplish this, we must be innovative, creative, and adaptable. The system cannot be static. Our new mission, vision, and values will anchor and guide the choices we make, what we do, why we're doing it, and how we'll do it. Healthcare is more than a profession. It is a calling. It is a mission, one that is essential to a vibrant and healthy community. Our new strategic plan includes our new mission, vision, and values. Our mission is to improve the health of Northerners by working with our partners to advance quality care, education, research, and health promotion. Our vision is to be globally recognized for patient-centered innovation. At HSN, we value excellence, respect, accountability, and engagement. Our vision is bold. Our mission will help shape the future of healthcare in the North. Our values will guide us. We will provide care that is of the highest quality and safety. It will also be patient-centered. At HSN, we recognize that the system must revolve around the patient and not the other way around. We will expand research and teaching so we can further develop a healthcare hub of excellence. These are the pillars of an institution that is devoted to quality.
HSN is improving the healthcare of Northerners in so many new and interesting ways. They're helping to promote the education of students. We're helping through research and the use of technology. And I think that there's a real exciting things going on here at HSN. The term hospital without walls means that patients would be able to access care when and where they need it. For example, if patients are living at great distance from the hospital, they may be able to use technology to receive care and follow up from their healthcare providers. For me personally, having worked at HSN for 20 odd years, I think it's a really exciting time. You can feel the energy in the hallways with the staff. I think although we have a lot of work ahead of us, it's a great opportunity to be part of this organization and a great time to be in healthcare in Northern Ontario.
I would like Health Sciences North to be recognized as a model for patient-centered care, not only for what we do to or for the patients, but also with the patient, where the patient helps us determine what would be good for himself or herself. I would like Health Sciences North to be recognized as a model for a hospital without walls, where we take care of patients from their arrivals in the emergency department to the departure into the community. A work that we obviously need to do with our colleagues who work in the community, community services providers. Finally, I would hope that Health Sciences North be recognized as a leader in patient care, but also for its new ways of teaching and its research, which is so good for the people of Northern Ontario. And I will say that when I came here 5 years ago, I talked about the Harvard of the North as a goal for Health Sciences North. My certitude is that it will become the Harvard of the North in 5 years from now.
The values that guide me in how I do my everyday job as an educator are competency, of course, being one of the most important, lifelong learning, respect and dignity for each other as healthcare professionals, and moreover, and most importantly, towards our patients and their families. The values that I impart on the staff that I educate are probably a very long, exhaustive list. One of the most important being accountability, professionalism. When staff challenge and ask questions, which is exactly what we want them to do, we have to give them an evidence-based rationale, because we are in an era of evidence-based nursing, evidence-based medicine, and so we have evidence-based reasons why we do things. There are quite a few memorable experiences that I could talk about. One in particular being when I walk at the nurses' station and I see people huddled together around the computer only to realize that they're doing tests together. They're actually finishing their self-learning programs, and they're doing it as a group, and there's such rich discussion occurring among healthcare professionals. So as a team, they're doing their own professional development, and that is a very proud moment for me as an educator.
Our strategic plan is also about leadership. A strong leader provides a clear direction for an organization. A strong leader articulates a vision that is compelling and daring, while offering the confidence of success. HSN's President and CEO is one such leader. In the brief time he has been here, Dr. Denis Roy has led an incredible transformation of our healthcare system. Dr. Roy recognizes the gaps in our system. That is why he is pursuing a hospital without walls. Under this approach, care follows patients from hospital to the community and into their homes. He also understands that to be the best, you have to attract and retain the best. Under Dr. Roy's leadership, HSN has achieved record-breaking recruitment levels of doctors and other healthcare professionals. In addition to focusing on attracting top healthcare professionals, HSN has identified 3 strategic priorities for our institution over the next 5 years. Our first priority is to achieve excellence in evidence-based care. This means we will provide high-value, cost-effective, and efficient care. It also means that the care will be driven by our patients and families. We will be innovators. We will be leaders in care transition. We will go beyond our walls to meet the health needs of our community. We will also tear down the walls and silos that sometimes get in the way of that care.
My experience with Health Sciences North has been overall a great experience. They've been very supportive and very uplifting and educational when it comes to our son, Benjamin. Benjamin was diagnosed with cerebral palsy. I was unfamiliar with that condition, again, and how to treat it. We were directed to occupational therapy, physiotherapy, and family services, and all were really very helpful. I think being more patient-centered when it comes to care is absolutely very important, critical for a patient. You don't want to feel as a burden as a patient. You don't want to feel unimportant or as a second thought, right? You're the main focus. You're the person that's ill. You have enough on your plate. Having medical staff around you that's supportive and is there to meet your needs is great.
It makes me feel very comforted. I'm not reassured that I know that my son will get what he needs. It makes me very happy to come to the hospital. I look forward to coming here. And I really enjoy the experience that I have with the people involved, very much so. You walk in and it doesn't feel like a hospital. It feels like another home, at least to me when I come here with my son.
First of all, I had congestive heart failure. I've had it for about 10 years. I really ran into difficulty about 3 years ago. And I came into the hospital, into Emerge, and I thought I was dying.
It is not only that person who has the disease. We, as a family, live with and help Ted manage the symptoms, the medication, the treatments, and it becomes almost a family disease. Although that sounds very negative, it isn't really, because what it means is that a person doing this on their own would be hard-pressed I think, to do everything as well as is necessary. We need to have good care here in Sudbury, and it's worth working toward.
As we continue to improve with our development and certainly diagnostic ability for various diseases and so on, if Health Sciences North is at the forefront, and especially with the medical school that we have in Sudbury, I think it's really great, not only for the citizens of Sudbury, but the surrounding area and the north. I would support whatever endeavors there are to improve that innovation.
I feel that HSN's new focus on being patient-centered is crucial to it improving. It's more aware of what people go through as human beings. I think the system needs to be much more transparent, friendlier, more human, really. Just to remember that people are ill and terrified, and really they may be angry because they're terrified, that emotion is really rampant and wrought up. So I think the human side needs to be considered more. So I think speaking up and asking questions, but really I also think the hospital has to ask how you're doing as well. That's key for me. If that comes out of all this work, then I'm happy.
Innovation is already driving our approach to health. Over the past 2 years, members of our surgical team have performed some innovative procedures not done before in Canada or North America. We have transformed the former memorial site into the Sudbury Outpatient Centre. It is a hub of excellence for outpatient care. The centre is helping people manage chronic conditions so they don't have to be admitted and readmitted to hospital. That is care beyond the traditional hospital bedside. This new strategic plan looks ahead to the next 5 years, but it also shows how much HSN has been transformed over the last 5 years. We have become much more than a regional hospital. Our new vision and mission go far beyond the scope of our former mandate, which was to treat illness and disease. An academic health sciences center like ours puts much more emphasis on positive health promotion. We do this through advanced research, training, innovation, and the pursuit of community partnerships. We are reaching far beyond our walls and into the community for a very good reason. Almost 90% of the factors that determine health are environmental, behavioral, and social in nature. The traditional model of a hospital is not designed to deal effectively with this reality. That is why we must look at redesigning our models of care, both within and outside of our hospital walls. The very foundation of this strategic plan stems from our patients' needs and our willingness to meet those needs. Our patients, staff, and physicians have shaped the foundations of this new strategic plan. So has our desire to be leaders in the transformation of our healthcare system. 6 months ago, Health Sciences North launched the Advanced Medical Research Institute of Canada, or AMRIC. As we speak, AMRIC is building a strong research program that targets the key health concerns and priorities of the North. Why is that important? Because research is healthcare. Ask anyone with diabetes who relies on insulin. Ask anyone with HIV/AIDS. Advances in research and treatment have turned HIV/AIDS from a terminal illness into a chronic condition that can be managed. We are paying more attention to the individual needs of our patients. This is especially true for our most vulnerable patients, children. The Pediatric Centre of Excellence will bring families of Northern Ontario the care they deserve for their children closer to home. Let's take a moment to hear from the leaders of AMRIC and the Pediatric Centre of Excellence.
Research matters because it saves lives. It allows us to keep ourselves focused in what we do. We also bring top talent to Sudbury, and it's very important to keep an organization like this focused on research, medical research, to allow us to answer questions that are very important for the people who live in Sudbury. Medical researchers want to come where research is created, where science is created, and where people are looking into problems that are important for a community. So we're doing research here to attract top talent as well. I love research because it allows us to focus on big questions. And those big questions that matter to people. Why do we have increased rates of diabetes? Why do we have increased rates of obesity? Those questions matter to researchers and allow us to keep focusing what we do.
You know, I think that we need to provide care for children in a place that is children or child friendly, I guess. Making sure that when they come in to receive health care, it's done in a way that is really more catered to their needs, because it's not the case that children are small adults. It's important that we make sure that they are dealt with in a way that is more appropriate for them. And families need to feel secure and happy with the type of care they're providing. But in the future, what we'd like to see is ultimately something that people can actually come to, can look at, and can identify with, that helps us to recognize that children's care is not only special but different and needs to be recognized as such here in the city. So I think the most important thing for us to consider as we go forward with this particular project and thought is to really focus on how important it is for kids, how important it's going to be for the community, and how important it's going to be for the children's health as they grow into adulthood, to make sure that we're able to provide local, high-quality care that emphasizes not only the clinical aspect, but also, as time goes on, looks at our educational mandate and our research potential.
The collective thought of all of us here at HSN is the principle that the starting point must always be the patient. Recently, HSN hosted a summit on seniors healthcare featuring Dr. Shalom Gluberman, the president of the Patients Association of Canada. He described how our healthcare system was designed to do things for the patient and to the patient, but not with the patient. An institution like HSN will always do things for the patient and to the patient, but it is when HSN will do things with the patient, which is the mark of a patient-driven health system, that we will be able to call ourselves a true patient-focused center. This is a future we want to help shape. Our strategic plan is built upon 4 foundational drivers that will guide us in our quest for change. The first driver is one of quality and safe patient-centered care. Everything we do must revolve around the best interests of our patients. Advanced research and education is another driver. We will continue to expand research and teaching opportunities because these pillars are essential to quality patient care. Another driver is enduring improvement. This will be a key component to our success. We will constantly strive to improve the care we provide. Our fourth driver is accountability to all. You cannot achieve improvement without transparency. We want to be an institution that responds to what patients are telling us. Our strategic plan is a culmination of our dialogue with our staff, physicians, and community. It provides direction and focus on how we will design and build better, more responsive care. But we cannot do this alone. The support and involvement of our healthcare partners will be crucial to our success.
The Community Care Access Centre have been working with Health Sciences North for many years now. But the last 18-24 months we've worked on very targeted projects. Working as a team is important for partners like HSN and the CCAC, I think, because the patients and families demand that from us, and that we bring the expertise whenever the patient needs it, whenever the family requires the care, and bring the expertise to them. It's a really patient-centered system, and in fact that's what the consumers, the patients, the communities want, is bring the services and wrap around me, and I think the hospital without walls is that concept.
At HSN, we want to express our appreciation to our patients, staff, management, physicians, volunteers, healthcare partners, and community leaders who have helped us reach this exciting milestone. We also want to acknowledge Dr. Denis Waugh, our President and CEO. We are fortunate to have a visionary leader to guide this transformation. It is important for the public to know and understand that our strategic plan is more than just a document. It is a pledge to serve you better, and we've put it in writing. As Northerners, we should be proud to have an innovative institution like Health Sciences North. There are many who are proud to call this our hospital.